So, welcome to another edition of Beyond the Hospital with me, your host, Dr. Wahib Awonoga. Today is another wonderful day. It's something that usually comes to my mind. Have you ever seen a child who hardly speaks and doesn't even smile so much, and the child avoids eye contact? Or maybe you've seen a child who seems to completely locked up in their own world, breaking things, or maybe you come across a child who sometimes throws up objects and feel overwhelmed with things and doesn't interact with other children in the ways you might expect. In many homes and communities across Sierra Leone, these behaviors are often misunderstood, and some of them will blame it on poor parenting and spiritual problems or even witchcraft. But what if these signs were actually a cry for understanding or a different way of experiencing the world? Today, we're talking about children with special needs, particularly those living with autism spectrum disorder and Down syndrome. These are big words, but we have someone in the house to break it down for us. There are real conditions that affect how children grow, learn, and connect. And yet, here in Sierra Leone, so to help us break it down, we have at the studio a remarkable guest, a woman who has dedicated a career to the care of children, one of the 50 most influential women in Sierra Leone, Dr. Aja Soviatu Sobola, a classmate of mine whom I so much reckon with and I admire so much and have been inspired by. She's a specialist pediatrician and advocate for inclusive child health. Dr. Sobola, welcome to Beyond the Hospital.
Thank you, Dr. Helege.
So let's start with the basics, Doctor. What exactly do we mean by children with special needs?
Okay, so for our people to really understand what we mean, special needs children are any set of children that require some form of specialized care or education. So it could be emotionally, it could be physical, it could be mentally, but they require that extra effort in ensuring that they live um, an appropriate or a normal daily life. So that those are the kind of children we refer to as special needs children.
Okay, now around this conversation of special needs, we've had people talk about autism spectrum disorders and Down syndrome. ASD, as I call it, what is it and how does it present in children?
So ASD is autism spectrum disorder. And as you've had the name, it's a spectrum. That means it spans along from mild, moderate to severe cases. So mild ones are often in the environment. We hardly get to notice them. But those with moderate or severe disease could present. And they have unique features they can present with that makes them exceptional. These are children that do not make social contacts. For example, they don't keep eye contacts. They rarely communicate. So there's a huge gap in their social skills. So they find it difficult to interact with other people. They don't maintain contact with the eyes. They hardly talk. They like to be by themselves. And they have what we call repetitive behavioral patterns. So you see these children, they have a way of packing their shoes, packing their clothes. They have a way of keeping to themselves. They have a pattern. If they want to wear their clothes this way, you cannot change it. There's nothing you can do that will make them change that pattern. If they like to sit in a particular space or a corner where they feel comfortable, you cannot move them. So we have such kids in our communities, in our homes, but sometimes they are being referred to as children with spiritual issues or that they have been very stubborn because sometimes you talk to them, they don't listen. And that's one thing the parents struggle with. And because of that, they are at risk of different forms of abuse, even from their parents, because they don't understand. Down syndrome, on the other hand, I call it the condition that has one additional chromosome. And that's one additional 21 chromosome.
So, doctor, if you want to talk all this way, you don't talk back Creole. How will explain that?
Oh, it's for Creole. I'll put I say autism spectrum disorder. Now, one kind disorder where they affect the communication. I mean, when beginning get them, they know they talk, they need delay for talk, and they know they interact properly with other people. Then, so you dey expect say when you meet speaking, all speaking jovial or most speaking jovial. When you meet children we get autism spectrum disorder, they know they look you, you greet them, they know they answer, they're unbothered, they don't want no sex, anything where they happen around them. So sometimes they go meet up when they meet up, they come back, you just pattern. Not only you actually they greet so, cause it's like they're deaf, so they're no one for mix with any other picking, and mostly you go see them in there on their own. And what I mean by repetitive pattern na that they always get way what they want for do, what they want for do. How then they eat, how you go make them sit down, how then they wear their shoes. If they pull their vaccine, what they put on at the remote, also they boot time a day for day. So they have all this, but those are the major things. They get this repetitive pattern of doing things, and then they lack communication and social interaction. And you know, say we as humans, they win as social beings them.
Exactly.
So whenever you get to picking, when not they interact, they seem very awkward. That's the one most people refer to them. Oh, this picking awkward or extreme. Or you get double. Okay. In double, you making it up to 4 years. Yes. So that's how they are. But Down syndrome, I call them the happy kids.
Okay.
How they get extra 21 chromosome now, so they're very happy. Now with community, then they collect
This whole chromosome. What do you mean by chromosome?
chromosome na the building block we make me you too. Yes. So we dey get from the mama 23, from papa 23, they come together and they make you a special and unique individual.
Okay. So, doctor, this picking because I can see some way that you can say this picking a mommy. You know something where you buy into, or later they call it picking a momo.
No. I would rather than say them get speech impairment.
Okay. So
Or they get
society
speech
call them
say-
when I run.
Yes.
Or
The tamu, I go say
derogatory.
derogatory, yes.
So, doctor, if you were me one know now, at what age this autism or Down syndrome, at what age can first appear?
For example, for autism, mostly before the age of 2 to 3 years. Some parents were very what else say were able to identify features quick, can pick them up by even their 18 months. Because by the time you begin the 12 months, with expecting I for begin say mama, papa, it they play. Then they babble, then they laugh a lot. So if you notice you get a picky, we know they do that later on. Any parents who are really picky, they begin pinpoint, say, oh, I they talk to me picking, you know they play with me, they laugh to me. So at a very young age, we can able picking them up.
So, doctor, waiting at the thing that we then need for look out for.
So majorly, like I say, the major thing when that's even with man and put as diagnostic criteria, now the fact say they know they interact and they know they communicate. So if you get speaking, we know they talk to you and
Talk to, or we know they mix with
you know they mix with it by age 1.5 year or 2 year. We dey expect say pikin for begin dey play now. They for the carry complain. Mama left. You know they interact. Or he always stay by himself.
Yeah.
He always they play. So then they go to play, but he dey play to himself. You know they mix. And then sometimes when they talk to her, either it's an say he deaf. Because again, when you get mutism, when I like mumu as how people can call her, like I say, it can either be saying they get a problem with the ear or they're autistic.
Okay.
So now part of the things in that okay they look for. They're not there and then he looks stubborn.
Yeah.
Yes. Okay, do it stop.
So, doctor, this early diagnosis, how important if you diagnose them early, waiting and get for do? Therefore, change anything.
You know, in life, everything I can always say early and prompt diagnosis, they change a lot of things. Especially for picking them, where that me really, really particular about. When we able to pick them up early, there are different forms of therapy. We get the non-pharmacological, we get the pharmacological. When we get things that what they do, and medicine the way we go give for help them, for contain them. So part of the things that were really important what we call cognitive behavioral therapy. Remember, I mentioned say this na a social problem, na a skill problem, na an interactive problem. So we get targeted therapists them. One we get for help them for talk. So the earlier you pick them up, the earlier you able to teach them how for talk well and how for respond. The earlier you pick them up, the earlier you able for teach them. So when you see you for shake your hand. When you see person, you for smile. When you see person or when you come in and play, you self for play with them.
Yeah.
So that is why it is very, very, very crucial for us to pick them up early. And then we go prevent them from a lot of traumatic experiences. And what it was, when they go through the trauma experiences here, like they not pick them up and they're being abused physically, you don't beat them, as Mark said, they're too stubborn. Now school, then they seclude them, they not interact, they become more locked in. So they are locked into their own world. Probably they can get some odd sounds the way they can pull. Then they can make, you don't know, it make like monkey, it make like snake, it pull this kind. So they have all these weird sounds. But if you pick it up early, you're able for, when they put on them tantrums them or delegate, you're able for do something, they might just hug them and they will just melt away. You might just calm them down and then can just, so you're able to train your children, even with them potty training, they don't go piss by themselves, they don't go toilet by themselves. You're able to do all of that when it is identified very, very early.
But doctor, you know if you say this sick here so, na sick for them big people, the one that will get money. Because some people have been all discussed with the way they say, no, the way they handle picking in Africa, you they handle say that picking they get sense.
Yes, I don't get a lot of communications with other people where they'll say, this is for money man day. No. The problem with people we not exposed or we not get that influence or affluence is they don't go for
land, they don't go for care. So that's thinking they normally the picking they grow up with them, probably they're not even aware and then they
yes.
Yeah.
And we tend to attribute them to spiritual things.
Yeah.
So that is why in Africa, but nowadays where the expertise we're having on average, like today at Sit Clinic, on average, I saw 4 children that have autism spectrum disorder. So it is very common now in setting. And the other thing where they make a worse than that the fact say, because of this iPad and the phone, they give we picking them.
Okay.
We don't get a lot of picking them now. Humans were made to interact. What God mean we be make for interact. So what we're doing is at a very tender age, we introduce we picking them to computers, to screen.
Yeah.
So they spend the whole day on the screen. They spend so much time on the screen. And the same with man, they will be introduced to all of this. Don't get me wrong.
Yeah.
It's very critical for picking and learning.
Yeah.
But it has to be limited. The recommendation is not more than 2 hours.
Okay. Not more than 2 hours screen time. But the one that we only buy laptop for them picking by iPad, no more than 2 hours daily.
2 hours daily.
Okay.
And then for young babies, then we go shock you.
Okay.
No screen time at all.
No screen time for babies. No screen time.
And we know that
That is a very good.
it's what thing that happen at the whole it's like what I'm saying is doesn't make sense.
Yeah.
Because Mrs. said all fall victim.
Exactly.
When I've been getting picking it. But now we're looking at the evidence. That's why we're having such a huge rise. Because when they're on their phone, they don't build communication skills.
Yeah.
When they're on their phone, they don't want to talk to you. They find somewhere secluded. And when you pull the iPad at their hand and they talk, that's wrong.
Yeah.
So we they induce we begin and now forget autism-like
disorders.
Yes.
So then there are something when a recess
There will be said
radio muscle. So doctor, in your experience, what are some of the biggest challenges where families can face in getting help for children with special needs?
Salon, the major problem I would say is one, first of all, identified it. For a very long time we did not have so much human resource, as in skilled personnel.
Yeah.
Now within the last 5 to 10 years, we don't build on we capital, as in more professional doctors, more skilled, more specialized doctors. So now we're making the diagnosis more often, but it doesn't end there.